Weinstein, practicing foot and ankle surgery out of Buckhead, Atlanta, Georgia. We've all heard about warts. It's something we learn about as kids, and unfortunately some of us will actually acquire at some point in our lives. But what are they really? Who gets them and how? What do they look like? And most importantly, how do you get rid of them? In this video, I'll answer these questions and more, and demonstrate a technique I've developed using Argon Plasma gas to eradicate refractory warts forever. A wart is a skin virus, and medically we call that verruca. Verruca vulgaris is the term used to describe a common wart caused by the human papillomavirus entering through a scratch or break in the outer layer of skin. Verruca plantaris is the term used to describe a wart on the bottom or plantar surface of the foot. The appearance of a wart varies by location in the body and thickness of the skin that is infected. On the surface of the foot, for example, it may appear as a small raised bump or a clear patch of skin. On the bottom of the foot, oftentimes small black dots are speckled throughout the lesion. These black dots can be confused as seeds, but in fact they are actually capillaries. A wart develops when two conditions are present: exposure to the virus and a small break or scratch in the skin. Beaches, for example, are a common site for infections since the grains of sand can easily abrade the skin. Any area in the environment that has moisture, including the ground, showers, or locker rooms, are potential places where you can pick up a wart. This is a fairly typical patient that comes in complaining of calluses, when in fact, these are actually flat warts or multiple flat warts on the bottom of the foot. This is yet another presentation of a wart showing the classic black dot pattern and pedunculated appearance in the plantar skin. Treatment of warts generally involves destruction of the lesion on the skin surface. Over-the-counter salicylic acid preparations can be effective, especially on the dorsal skin. However, for plantar warts, or when that method fails, we'll use a caustic agent in the office. It's a chemical that's applied once. It's usually pain-free, and it takes about 2 weeks or so for the wart to fall off. If this is ineffective, or if for cases of multiple warts, we may choose to go the surgical route. This involves either local anesthesia or some mild sedation, enucleation of the wart, preparation of the wound bed, and then application of some type of heat energy, be it laser, or in the cases I'll show you, argon plasma gas. These procedures are 99% effective. They're pain-free virtually. They result in very little postoperative care, and the patient can move on with their life and not worry about the lesion again.
One, 7:51 here to start. 7:51? Mm-hmm.
Get points for popping his toe. Okay, that's good. Really?
Mm-hmm.
This one started to go up the nail. So you can see where it was heading. That probably wasn't going to get better very easily with Dr. Scholl's wart remover. it sweeps away all that blood. And then you can tissue's perfectly sealed.
As you can see, the results are outstanding. If you have any questions or if you would like to schedule an appointment, feel free to call my Buckhead office, 404-351-5015. I'd be thrilled to get you back to work-free feet in no time.